What is valve replacement surgery? Our heart has 4 valves: the aortic, mitral, tricuspid, and pulmonary that control blood flow in and out of the heart chambers. These valves open and close with every heartbeat, ensuring blood moves in the correct direction. But sometimes, due to aging, infection, or congenital conditions, one or more valves may become damaged or diseased. When a valve stops functioning properly, valve replacement surgery may be required. Understanding heart valve problems. Heart valve disease generally falls into 2 categories. Stenosis, when the valve opening becomes narrowed, making it harder for the heart to pump blood. Regurgitation or insufficiency, when the valve doesn't close properly, allowing blood to flow backward. Both conditions can put extra strain on the heart, leading to symptoms like shortness of breath, fatigue, chest pain, or even heart failure. What is valve replacement surgery? Valve replacement surgery is a procedure that replaces a damaged heart valve with a new one. This can be done using either mechanical valves, made of durable materials like titanium or carbon. These last long but require lifelong blood-thinning medications. Biological valves made from human or animal tissue. These don't last as long but usually don't require long-term anticoagulants. Types of valve replacement procedures. Open heart surgery. The traditional method where the chest is opened and the heart is temporarily stopped using a heart-lung machine. Minimally invasive surgery, smaller incisions, and quicker recovery time. TAVR, transcatheter aortic valve replacement. A catheter-based approach, often used for high-risk patients who cannot undergo open heart surgery. When is valve replacement necessary? Doctors may recommend valve replacement surgery if the valve damage is severe, symptoms interfere with daily life, medication or less invasive treatments are no longer effective. Recovery and outlook. Recovery time depends on the type of surgery performed. After traditional surgery, hospital stays may last about 5-7 days, with full recovery taking several weeks. Minimally invasive or TAVR procedures typically offer faster healing. With proper care and follow-up, most patients return to a normal, active life and enjoy a significantly improved quality of life.